Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. If you're listening to this episode on audio, I want to give you a quick heads up. Today's episode is actually a full-length webinar that I recorded, and to get the best experience, I highly recommend watching the video version on YouTube. If you're driving or somewhere where you can't watch, understand, just listen. But to actually get the ideal concept of this, makes sense to watch it on the video version on YouTube. So just click that link. And so this isn't just a conversation. This is actually a visual walkthrough of how gut health actually breaks down, and more importantly, how it can be rebuilt the right way. In today's episode, I am teaching our 6R gut healing framework, the exact system we use at Ascend Functional Health and that I use personally to help finally get answers when bloating, fatigue, brain fog, food reactions, skin issues, and chronic inflammation just won't go away. I'm going to break down why gut symptoms persist even after normal labs, the biggest mistakes that people make when trying to heal their gut, and the 6 non-negotiable phases required for real, lasting repair. So whether you're dealing with gut issues yourself, or you want to understand how gut health impacts your hormones, immunity, brain function, and longevity, this episode is for you. If you can, head over to YouTube and watch the video version for the full experience. Otherwise, let's dive in, and I hope you enjoy this. All right. Well, thank you everybody for joining today. And if you're watching this recording, I want to thank you for tuning in. My name is Dr. Alfred Alessi, and I'm here to take you through one of the most emerging topics of health that we are hearing all over the place nowadays. But I really want to break down what is often missed by these fad diets or by conventional medicine, and that is the gut. And a lot of people have heard of the gut, probiotics, microbiome, these buzzwords that we hear all the time. However, many people are not sure what to do about it when they possibly have some type of gut dysfunction or gut issues. And so that's what I'm here to chat with everybody about today, and I appreciate you joining me. So let's get right into it, and I'm not going to take too much time here. I want this to be quick, easy to digest, and just filled with valuable information for you to be able to use and implement in your life. And so, number one, the reason this is so important and is why we focus on this in our clinics is that the gut is really ground zero for everything when it comes to your health. And so there is what we call this gut health axis from the inside out. And so the gut is often the first thing that can be impacted to then lead to other health issues. And so, this really is a silent epidemic that nobody is really talking about, because over 70% of Americans do suffer from some type of gut dysfunction and they don't even know it, because it's manifesting in other ways. It's showing up as immune system problems. They're constantly sick, or skin issues like acne or rosacea. It could even be oral health problems. The gut has this inside out effect on the rest of the body. The common ones that we see obviously are things like bloating or constipation and reflux, which can very much be tied to the gut. However, the ones that are less commonly known are things like hormone imbalances or skin issues. And so, the reason we want to get into this, and the reason I am so passionate about this topic, is because of realistically what we call the broken healthcare model. If you look at this diagram here, the difference between conventional medicine and when we talk about functional medicine is very much the term function, right? The conventional medicine approach is not focused on how your body functions. It is focused on symptoms and relieving you of those symptoms. It's very much pain relief. And so when we talk about functional medicine, it is focused on function. We want to know how each system in the body is working together in coordination for optimized health and function. And so, it's something that I'm passionate about, again, because of my own story. And so, I went through my own health journey. I struggled with issues from my gut to my immunity that then manifested itself in autoimmune condition. And so, the thing to think about is that many patients that we see are frustrated They're unsure of where to go. They don't know what to do, and they're living a very bleak life because of issues that they have been dismissed. They've gone to their primary care doctor and been told, this isn't a big deal, or you're just making this up, or it's all in your head, right? Now, I could be frustrated by that, just hearing that, because that triggers me from, again, my own history. And so when I get into what we're going to talk about today with the 6R protocol, again, this very much comes from a place of understanding and empathy in that I was the patient before. And so I had just become a doctor about a year before, and then I just developed an overwhelming feeling of sickness in my body, and I didn't know what was going on. I couldn't function during the day. I had very much a lack of clarity and cognitive focus. I was tired all the time. I had skin acne and issues all over my face, and I was sick. But I went to a primary care doctor who told me that I needed to just take some steroids and it would go away. I didn't buy that. And so I decided to go down my own rabbit hole and heal myself, which took a long time because I had to create these protocols throughout the process. But on the back end of that, I was able to heal my leaky gut, my inflamed gut system, and my dysfunctional microbiome. And on the back end, I was able to remit myself from autoimmune thyroid issue. And now I live with optimal health, I would say. And so, again, this was very much part of my journey. And so I wanted to create a protocol based on what I did for myself that has been proven to, and we have done this with dozens of patients, work for almost everyone. And so the reason I say almost is because, I can't claim to say I can help everybody if something is too far gone. However, we can help a lot of people when we use the proper foundational protocols. And that's what we're going to get into today. And so, again, the gut is your body's command center. It is what sends signals everywhere. This diagram can obviously get lost in the weeds here, but if you look at it, basically the lining of the gut down at the bottom is what talks to the rest of the body. It is connected to our nervous system, which is then connected to our brain. And so you often can hear nowadays people saying the gut is the second brain. I would say that the gut is actually the first brain because the gut tells the brain what signals to then produce. And so without one or the other, we cannot live, we cannot survive. And so again, what I want to make sure I'm clear about today is that this is a protocol that has been proven over time and time again within our clinics, and myself included as a patient, to help people who are suffering from any type of inflamed gut dysbiosis, dysfunctional ecosystem within the gut that is then leading to outward effects like hormonal issues and skin issues and things like that, joint inflammation. This is not a quick fix. This is not a diet or a supplement routine. And so if that's what people are ultimately looking for, this is going to be more than you want realistically. But this is a systematic repair program that restores gut integrity from the inside out. And so you're probably wondering, oh, what is it? And so let's just get into it, right? And so before we're able to repair something, we have to know what's going on. And so let me touch on real quick what we call our deep gut scan, which is our complete microbiome test. This is a test we run on every single patient. It's going to give us a structured report, looks just like this. Now, this report tells us a lot. And so it's very, very in depth. But this report is also amazing because it uses AI technology to break it into a digestible way for patients to be able to read if they're not doctors. And so the few pages that we see on the left side is the actual overall score. It basically gives you a score. Hey, we all been through school. We know that you got an A, a B, a C, and that was your grade, right? So it gives you a grade of your overall gut health. It also gives you a score for the amount of good bacteria that's within your gut. And so is there enough of the good? Is there too much of the bad? That's where then it breaks it down into detail, as you can see on the other slides, that which species of gut bacteria are we lacking? Which species of gut bacteria do we possibly have too much of? And how can we then make changes within our diet, within our lifestyle to affect these in a positive direction? It also gives us a score of what our body is doing with our metabolism. Are we actually breaking down and utilizing certain nutrients, certain compounds that we ingest, or things that we take in from the environment? Are we detoxing well enough? It gives us that score as well. So with this test, we are able to confirm a lot, whether somebody does or does not have leaky gut syndrome. We're able to confirm the ecology of their microbiome and then what probiotics they may or may not need. And so oftentimes people say, well, I had gut issues and I was dealing with, I just took a probiotic and it actually got worse. It's like pouring gasoline onto a fire if you take the wrong probiotic for your gut. And so everybody is different. Everybody's been through different things in their life, been experienced to different things, eaten different foods. And so our gut microbiomes are vastly different. It's actually amazing that they show studies of identical twins. And I have identical twins myself. And they have completely different microbiomes because they are different people. Their genetics are the same, but they ultimately make different choices that lead to a different ecosystem within their body. And so it's fascinating. And so now what do we do with this information, right? And so we've got this test that tells us all this stuff. Now we would do what we call the 6R protocol. And this is what I want to talk to you guys about today. This is what I created out of my own struggles, my own health journey, made a foundational program that I've refined over the years, been doing this for about 6 years. I've refined this to a way that is replicable so we can repeat this with different patients, but customizable as well. And so not everybody gets the exact same protocol, but it is very much the foundation that is the same. And so again, this is a step-by-step system to heal from the inside out in about 6 to 8 months. And so let's go through it. So step one, number one, first thing we have to do is we have to eliminate the harmful triggers. These are things like processed foods. These are things like allergens or toxins or pathogens, things that are coming into the body, whether it's through the ingestion like food or whether it's on the skin, topical products as well, that are then causing inflammation and causing dysfunction within the system. So in order to fix something, we could all agree that you have to stop hurting it in the first place, right? And so that's what step one is. Without step one, the rest of the protocol does not work. Now, from there, okay, we've eliminated and we've gone through this program. This first step takes about 30 days, 30 to 45 days for the average person. And so it's elimination diet based. We are using specific things, substances like herbs and breakdown products to get the body to start eliminating and detoxifying before we get into what we call step two, which is replace, the second R. And so this is where we now start restoring missing digestive factors like enzymes, stomach acid, bile salts, things to optimize the way that your body is breaking down nutrients. And so over time, we're able to then now support the way that your body was dysfunctional before. Maybe your body was not producing enough hydrochloric acid to break down protein. The protein was then staying around in the gut a little too long, creating inflammation, leading to issues of like bloating and things like that. And so again, step two must only come after step one, but this is now where we prepare ourselves for step three, which is where we begin to now reinoculate the gut. This is where we want to rebuild a healthy microbiome. Again, this is very much going to be based on somebody's deep gut score. What probiotics are they lacking and what probiotics are they having too much of? And now how do we start to balance that out? And so we should always have a low level of these, what we call like pathogenic or, non-helpful bacteria. There should be a low level of those in our gut at all times because then our body knows what to do with them when we encounter that. However, it's when those start to imbalance the good guys that's when we start to have issues and we start to really can feel those effects. And so the reinoculate phase is usually where people have the most profound, I want to say symptoms from this because we are pouring things into the body, right? We are putting some gasoline into the fire in a good way in this sense, but based on their data and based on their test. From there, we've now reinoculated the system with the good things. We're using prebiotic and probiotic rich foods The diet is very much a big part of this. Now we start working on repairing the gut. And so when there's inflammation, you can see in this image, things like leaky gut can happen. The dysbiotic bacteria create inflammation, which then breaks down the lining within the gut. That lining now being more porous allows for things to get into the bloodstream. That's why you then have these outward effects on the hormones, on the skin, on the cognition in the brain. And so it's very important, excuse me, it's very important that we support the healing of this, but only after we've reinoculated and rebalanced the system. Because if not, this problem's just going to come right back. Hey, busy professionals and parents, let me ask you something. Do you need help with your low energy, stubborn weight, brain fog, gut issues, or hormones, but you don't know where to start? Well, you're not alone. And the biggest problem is that modern healthcare is designed to diagnose disease, but often misses the dysfunction that begins years earlier as under the surface symptoms. That's exactly why I created the Functional Medicine Starter System. This is a structured, physician-led process designed to uncover what is actually driving your symptoms, whether it's rooted in gut health, metabolic function, inflammation, nutrient status, or hormonal imbalance. No guessing, no generic protocols, just real data and a clear plan. So if you're tired of searching for answers, but you're not sure how to begin solving your health issues, go to the link in the podcast show notes to learn more about the Functional Medicine Starter System. Because once you have clarity, you can finally start to feel like yourself again. Now, let's get back to the episode. Now, from step 4, this is the fun part, is where people start getting into more of a maintaining this and a healthy life, right? Usually it's the first 3 to 4 months that people feel the most things, the most maybe negative side effects, or the most what we would call like reactions. And then getting through to the back end, the rebalance phase is where we now start working with them on more of a lifestyle component, as well as with certain foods and nutrients and nutrition to make sure we're creating balance. Are they sleeping enough? Is stress an issue that we need to manage that maybe led them down that way in the first place? Exercise, lifestyle habits, all these things to create an ongoing of whole body health. Again, the gut is the focus, but the gut affects everything else. From there, we can start slowly reintroducing foods back into the diet. We want to pay close attention to, what does your body do with that? Do we start adding things back in that maybe before were creating inflammation and causing you issues and now they're not? Fantastic. Do we want to reintroduce things like alcohol and processed sugars? Not really. Those are things that ideally we avoid long term. Not to say that we can't enjoy ourselves every now and then. However, again, do we want to go back to where we were? Most patients would say no. And so if you're dealing with some type of significant dysfunction, you would most likely agree with me. I would say, based on my own path, that as well. And I've been able to maintain this over time by just sticking to a clean way of eating, avoiding processed foods, maintaining a level of low stress, exercise, and whole body health in general. And so on the back end of this, people always ask, well, how do I know it worked? This is where we talk about like the bonus R, right? The 7th R. This is retesting. So we would likely retest the deep gut test that we did at the beginning to see what changes we made. Oftentimes we'll run a food sensitivity test as well at the beginning with patients to see that what foods are triggering things. We can retest that as well. And we will often see foods that were creating a level of inflammation and like a allergic response are now less or gone. And so it's actually pretty awesome when we do this and we do these tests and we get data to not only like the patient feels better, but we can prove it that, hey, we fixed something. Now patients have this high level of positivity and hope that, hey, I'm just going to maintain this and get great results. And all the patients that we take through this, we don't just take them through a protocol, fix their gut, and then good luck. No, we want to maintain a level of positivity with them. So we always give them access to our resources, and we fill them with tons of knowledge so that you're not just on your own on the back end of this. You do have the tools that it takes to maintain the results that you've earned. And I say earned because you did put in the work. And so, we've talked about the gut. We've talked about the 6 R's and how we use that strategically to fix a dysfunctional gut system. And this really is the last gut healing system that you will ever need if you do it correctly. And so, as we've gone through this and we've talking about that, I just want to give me a show of hands, guys, and just put your hands up if you agree. Does it make sense that if we fix the gut, the rest of the body can heal? Right. Would you rather get to the root cause of something instead of just masking the symptoms, taking things like proton pump inhibitors and, Tums for the rest of your life? A lot of hands. Okay. So everybody would agree. So, that being said, there's really 2 paths that you have when you are dealing with something like this, right? And it's really path number 1 is taking action and making a change to fix it. And path number 2 is staying the same. And so I think by the show of hands, it would make sense that most people lean towards the action path. Now, I appreciate that. And I appreciate everybody joining in as well. What I want to do is I want to give you guys an offer here. And this is something that we like to do when people join the webinar as a special thank you for joining me. This is a limited time offer for an introductory consultation with myself to see if this is something that you could benefit from. Now, $99 for the consultation. Normally it's $250, so it's marked down. This is only available to 10 new patients every month. Now, you see there it says no risk. That means if we do a call or we do an appointment and you've spent $99 and it turns out that this might not be a good fit for you, we don't want to keep your money. We will refund you that $99. So there's literally no risk here. Now, as a special bonus, if you want to get this going and you book an appointment today, as a part of this webinar special, we'll give you 10% off of your deep gut scan and any other lab testing that you want to do as a special thank you. And so, again, this is a limited time offer. These go quick because a lot of patients need this and a lot of patients come to us for this. So there's only 10 available each month. And then for today, the 10% off the testing. I appreciate everybody joining me. I appreciate you guys for always being so giving us such good feedback and being on top of these kind of things. And for even joining this, that means you are thinking proactively about your health. I hope you all have a great rest of your day, and I will talk to you soon. All right. I want to say thank you for tuning in to this episode and taking the time to learn and educate yourself and really understand the concept of what we're doing with this gut protocol. And again, it's not just about gut health, but about how your body actually works when given the right inputs. Everything you just heard is the foundation of the 6R gut healing framework, a structured root cause approach designed to move you from guessing to clarity to real results. If this webinar resonated with you and you're ready to take the next step, or someone you know needs to hear this, I want to invite you to start your 6R gut healing journey. You can head over to ascendfunctionalhealth.com and book an introductory appointment with our team in person or telehealth. We'll take the time to understand your story, review your symptoms, and determine whether this program or maybe another approach is even the right fit for you. There's no pressure, just answers, direction, and ideally a plan. So thank you again for tuning into Health Decoded. And remember, your gut isn't broken, it just needs the right roadmap.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask at ALESSIFXhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.